If you were diagnosed with a terminal illness, would you want to be able to make the choice to peacefully go to sleep and not wake up? Or would you rather not have a choice and have to suffer every second of the rest of your life? What about a loved one? Would you rather see a loved one suffer emotional and physical pain for the remainder of their days? Or would you rather them be able to peacefully go to sleep and not wake up? Did you know that 70% of terminally ill patients prefer to die in their homes, but only 25% get to? I work in a long-term care facility and I deal with dying and death a lot. And one of the most heart-wrenching things to watch is someone that is terminally ill and is suffering and is in so much pain not be able to peacefully go to sleep and just cross over to the afterlife. We try to make them as comfortable as we can, but towards the end of their days, there's nothing that comforts them enough. We as loved ones need to fight for physician-assisted suicide. We need to fight for physician-assisted suicide to promote autonomy, to promote human rights, to end unnecessary suffering, and we need to educate the misinformed on physician-assisted suicide. Autonomy is defined as the right of self-government. This means that we have the right to choose our healthcare providers, the kind of car we drive, what we're going to have for dinner at night. We should have the same right at the end of our lives. We should have the right to choose how we're going to pass away if we are terminally ill and suffering every day. We should have the right to take advantage of physician-assisted suicide and peacefully go to sleep and not wake up. We as loved ones need to fight for physician-assisted suicide to end unnecessary suffering. Terminally ill patients are incontinent most of the time, can't feed themselves towards the end of their days, and are bedridden. They are suffering emotionally, they are suffering physically, and we as their loved ones need to advocate for them to not have to suffer. That should be their right to not have to suffer. Many terminally ill patients feel as if they are such a burden on society. They're such a burden on their caretakers and their loved ones. It's not fair to make them suffer and feel that way. We, as loved ones, also need to fight for physician-assisted suicide, and to do that, we need to educate the misconceptions of physician-assisted suicide. Many people think physician-assisted suicide is a slippery slope. They believe that if you're going to do it for terminally ill patients, and that opens up opportunities to do it for mentally ill people or someone who just wants to die. But if we keep the safeguards that are in place in the states that physician-assisted suicide is legal in, it's a pretty foolproof plan, and it's not any less safe than any other healthcare protocol or procedure. So for physician-assisted suicide, you must have a diagnosis and prognosis of 6 months or less by 2 separate doctors. You must be deemed competent by a psychiatrist, and you must be 18 years or older. If we follow these safeguards, it isn't as dangerous of a slippery slope as people that are uneducated may assume. Another huge misconception when it comes to physician-assisted suicide is that a physician is going to give them a lethal injection or IV medications to make them pass away, and that couldn't be further from the truth. The process for physician-assisted suicide is the physician prescribes a large amount of sleeping pills, mostly barbiturates, and he calls them to the pharmacy. You pick them up. The patient administers them to themselves. The patient is the one that administers the medication when they are ready, giving them a chance to say goodbye to family, giving them a chance to be set mentally to cross over into the afterlife. The physician does not actually put the medication in a terminally ill patient's body. And a terminally ill patient may just have a lot of peace just knowing they have that option available if they were to need it. Many might not ever even use it, but many will, and they should have the right if they need to or want to. So we, as loved ones, need to fight for physician-assisted suicide to promote autonomy and human rights, to end the unnecessary suffering of our loved ones, and to educate the misinformed people of America and of the world about physician-assisted suicide. Thank you.